Can vision loss after stroke be restored? Most people who have vision loss after a stroke will not fully recover their vision. The main types of eye problems that can occur after a stroke include visual field loss, eye movement problems, and visual processing problems. Some recovery is possible, usually in the first few months after a stroke. Therefore, the earlier you start the vision rehab, better recovery will be expected. The following list includes some of the most effective vision rehabilitation exercises after stroke. Directional tracking. Start by taking a pencil and holding it about 18 inches from the face at eye level. Then, with the eyes focused on the pencil's eraser, slowly move it from left to right as far as it can be seen without moving the head. Return to the center, then move the pencil up and down as far as possible within the field of vision. Again, make sure to avoid moving the head so that the eye muscles are working rather than the neck muscles. Repeat this 5 times in both directions. Clock rotations. Begin by fixing the gaze straight ahead. Then, picturing a clock in front of the face, look directly up at 12 o'clock with the eyes, without moving the head. Feel a gentle stretch in the eye muscles, holding there for 3 to 5 seconds, before returning to a relaxed forward gaze. Repeat this process all the way around the clock, looking toward 1 o'clock next, then 2 o'clock, and so on. Near and far focusing. Start by holding the finger out about arm's length away. Breathe in while looking at the tip of the finger, then breathe out while gazing into the distance past the finger. Switch between focusing on the finger and focusing in the distance, a total of 10 times. Peripheral vision stimulation. This exercise can help to improve peripheral vision, as well as increase understanding of visual spatial relationships. Ask a family member or caregiver to hold 2 pencils, one on each side of the survivor's face, or at the far sides of their visual field. Look straight ahead, and make sure that both of the pencils can be seen using the peripheral vision. Then, ask the caregiver to move one pencil slightly closer, and one slightly further away, and guess which pencil is closest. Repeat this 10 times. Light therapy. Research shows that daily exposure to specific wavelength of red light, syntonics and multispectral light can increase production of ATP, which is the energy source of the nerve cells. This increased energy improves the retinal function, leading to central vision and peripheral vision restoration. This kind of light therapy also increases blood flow to the optic nerve, reduces oxidative stress, and promotes the survival of optic nerve cells. Alternating microcurrent stimulation. For optic nerve damage caused by stroke, AC stim can dilate the blood vessels and increase blood flow to the retina, bring more oxygen, glucose and nutrients to the eyes and brain. It wakes up the dormant optic nerve cells and helps the sick and damaged optic nerve cells grow back to function. This increased blood supply allows the optic nerves to eat, breathe, metabolize, regenerate and detoxify. It also activates the neuroplasticity and improves brain's visual capacity by rewiring and refiring the neurotracts, which is the visual nerve pathways that go from the retina to the optic nerve and then to the brain. Please send your full medical records to us for a treatment plan of your neurovision rehab after stroke.